everyone. Thank you for tuning in, and welcome to First Global's second STEM Talk. That's part of our programming for the 2021 First Global Challenge, Discover and Recover. I'm Jeff May, president of First Global, and I'm thrilled to be moderating today's talk. As we learn from life today to build a better tomorrow with STEM, we're hosting a variety of sessions throughout the season to hear from STEM enthusiasts about using these scientific fields to discover and recover. Today we're focusing on health. And joining us today is Dr. Julie Gerberding, a leading expert in public health. She is the Executive Vice President and Chief Patient Officer at Merck, and also formerly ran the vaccine division at Merck, which is highly relevant to our talk today. Merck is a leading global pharmaceutical and vaccines company, as I'm sure many of you know. She's also was the director of the U.S. Center for Disease Control, and she's also an accomplished medical doctor and is currently an adjunct professor of medicine at the University of California in San Francisco. I've had the privilege of working closely with Julie at Merck, so it is a personal and absolute thrill to be able to interview her today. And today we'll be hearing her insights on the health challenges that have resulted from the COVID-19 pandemic and the innovative solutions that are being used to tackle them. It's great to have you with us, Julie.
Thank you. It's great to have a chance to talk with you.
Wonderful. Well, let me get into the first question. And when we discussed having someone come and address STEM and healthcare with us, I couldn't think of a better person to help us cover the topic. You've been on the front lines dealing with a range of pandemics and other health crises throughout your career, ranging from HIV/AIDS to SARS to Ebola, more recently Ebola. We've made great strides in containing those earlier pandemics, largely through new medicines, vaccines, and other health interventions. But I now want to turn to the 800-pound gorilla in the room, and for once it's not me, although I've put on a bit of pandemic weight. It is about the pandemic. I wanted to get your thoughts from your vantage point, where we are in the course of the pandemic. I think we're all hoping that we're starting to see some sort of light at the end of the tunnel, but also recognize that it's a large world out there and we have teams spread all over it. So I'm sure they're interested in getting your thoughts from a global perspective on what's happening.
I wish it was a simple answer to your question, Jeff, but on the one hand, we have the virus, and we have the variants, and we also have a lot of very specially vulnerable people in the world. Against that, we have vaccines, and we have vigilance, meaning social distancing, masking, and all the other things that we need to do. And I would say right now, in most parts of the world, we're leaning in the direction of vigilance and vaccines having an impact, but in other places, it's neck and neck. And in a few places, the virus is clearly winning. So very variable, but I think in the areas where we've been able to really implement highly successful vigilance, plus or minus highly effective vaccines, we see that the light is at the end of the tunnel. We can look forward to containing this, but the race is not over yet.
Yeah, and I appreciate that because we've seen sort of ups and downs in recent time. With there being the vaccination rates going up, although not as fast and as widespread as we might have hoped. But also the vigilance part really resonates with me because it's easy to start to think, okay, we can begin a normal life again and let our guard down, and then we could have a bad outcome from that. So wanted to sort of get your perspective now on this pandemic versus the other things that you've encountered before in your career. It seems like with each one, HIV/AIDS, SARS, Ebola, each has its own dynamic, its own features. Wondering if coming out of, or dealing still with COVID-19, are there aspects of it where there are lessons learned, or is there something, sort of the magic ingredient that can inform how we approach health crises going forward? Or is it that each one is so different that the next thing that may happen to us in the future will itself present a whole different profile and require new types of solutions?
The answer to this is complicated also because, yes, there are many lessons we can learn by looking at the past outbreaks or pandemics that we've experienced. But at the same time, each pathogen and each situation brings its own unique challenges. I sort of bookend my whole life on the basis of the AIDS pandemic. I know the WHO doesn't call it a pandemic, but it's a pandemic and it's 40 years old. And then on the other hand, we have this coronavirus pandemic, which is relatively young by those standards, and yet it feels like it's been interminably long. In between that, those two bookends, we've had a number of outbreaks that have been much more easily contained. And the lessons we've learned in all of that, I think, could be summarized in a couple of bullet points. One is that emergence happens. We're living in a world where new infectious diseases are going to be emerging, I think, more frequently and more powerfully and spread more easily than ever before. The second thing is that it's very difficult to predict when, where, and who will be affected. But we can say that, in general, the most vulnerable people in the world are always the hardest hit. That's what happened in AIDS. That's what happened in Ebola. That's what we're seeing now with COVID. Then I think the third thing to say is that while we can improve our preparedness, we have never fully embraced the importance of broad spectrum global preparedness, that we really do live in a global community and we're only as safe as our least safe location. People who live in the artificial world of comfort in being isolated or comfort in being in an affluent country don't really recognize that we really are in all this together.
Yeah, I think that's an important point to really resonate with. And we get into the vaccine question, and we do see rates different, schedules and all that around the world, and there's been the supply issues. Sort of your thought on, are we turning the corner on that as well, and there will be more supply coming forward?
The supply and access issue is very challenging. If you think about influenza, where from a medical perspective, everybody should have a flu shot every year. Yeah. And globally, we don't even come close to that. I think the maximum imaginary doses of influenza vaccine that get produced on an annual basis, somewhere around 2 billion, when we need, several billion more than that. So the challenge of getting 7 billion or 14 billion doses of coronavirus vaccine manufactured in a short period of time is daunting and is not really doable, to be completely candid. Having said that, everybody is leaning into it to try to do everything possible to speed up manufacturing, and then to look now at ways to spare doses, meaning could we give less vaccine and still have an effect? Could we space out the doses further? What can we do to try to make the vaccine that we have go as far as possible? But also in some countries, they actually have received vaccine, but they haven't been able to use it. And that's the terrible tragedy, where we're not able to get it out into the arms of the people who need it because many countries don't have programs for immunizing adults. So the vaccine sits in freezers or in warehouses and is not really getting into the arms of the people who need protection. So solving for all of that on a global basis is truly a magnificent challenge, and we need bright people, young people with good ideas and new solutions to come forward and help us with that.
Well, speaking of bright people with new ideas, we got excellent questions from our teams, and I wanted to turn to those now. And let me start with the one that came in from our team in Turkmenistan. They ask, at a young age, you chose a career path that involved preventive medicine, epidemics, and vaccines. What inspired you to choose this particular area?
I was a little girl in a very small town in a rural community. And I think I have an overactive empathy gene. And so from a very early age, I was interested in solving the problems of the birds that I found in our yard with a broken wing, or the injured rabbit whose vision had been impaired. I was constantly in the state of trying to help save some injured animal or bird. But my parents were the kind of parents that encouraged science in our home. So I was given a microscope at a very early age. I learned to collect bugs, understand insects and so on and so forth. So science was just part of how I entertained myself in this little town that I grew up in. So I think always having the immersion in the natural sciences, it was not that big of a stretch to think about, well, then how do all of these parts of the natural ecosystem work together, and what are the things that interrupt that and cause harm, or species to go extinct, or people or animals to get infectious diseases and suffer from plagues or pandemics. So my mind was kind of already geared up to think about that when, fast forward, as a young intern in San Francisco at the very beginning of the AIDS epidemic. We didn't know we had an AIDS epidemic, we just knew that we had a lot of people who were dying of something that turned out to be infectious. So my whole career got reoriented toward infectious diseases at that point.
That's amazing. I have this image of birds and other animals bringing their hurt members to your house for the treatment, but
that was my mother's theory.
That was her theory, yeah. But it has that element of having, you know, the support to be able to investigate that area of science, and begin learning from it, and then have it become a life's passion, which it still is, obviously, for you. Well, let me turn to a question from Sri Lanka. As a leading woman in the medical industry, do you have any advice for girls and women who have similar aspirations as yourself?
Absolutely. First of all, never give up. If you have a dream of science or any other pursuit, stand strong and just recognize that, follow your heart, follow your passion, and just keep going. Because you will have obstacles, and women have special obstacles that they have to overcome. But stick together, because sometimes one woman can do a lot, but a group of women can do anything. And I think that's where I get my kind of fortitude when things are tough. I turn to other women. I share my experiences, I learn from them, I get mentored, sometimes I'm sponsored to help me really make better career decisions. But that network of women is incredibly powerful, both for learning, but also for supporting people when times are particularly tough. I guess the last thing I would say is, don't be afraid to speak up. There a lot of times when women encounter obstacles, it's not because there are bad men in the world. It's because people just have different ways of seeing the world. And sometimes it's okay to say, I see it a little bit differently than you do. Or if it's more of a personal issue, you can say, when you said that, I felt like you were ignoring my contribution to solving the problem. I'd like you to understand my contribution and, make that more visible.
Now, I'd like to turn to our next question, which actually is, we had several teams ask very similar questions that I all thought were excellent, so we sort of have them put together into
bundled.
Bundled, yeah, exactly. But they came from our teams in Tunisia, Paraguay, and Bosnia and Herzegovina. What are the biggest innovations you've seen in healthcare, and which ones are helping us the most in this pandemic? And in particular, what has been the most important STEM tool that's been used in the pandemic so far?
In this pandemic, science is clearly on our side. I don't think we've ever seen a situation where we've had so much innovation so fast. There are more than 800 vaccines, antivirals, and immunologic therapies that are in various stages of clinical development, including the vaccines and treatments that have already been authorized for use. This is absolutely unprecedented. And of course, of all of those, I would say that the vaccines are the most important innovation, because they really do have the power to be able to contain the spread of the virus. So that is I think, Nobel Prize winning intervention. But there are also interventions that have to do with how people are cared for that have been incredibly important. And I think one of those in many areas is the ability to care for people remotely. That may be from a cell phone, it may be something more sophisticated, but the idea of people managing their SARS-CoV infection at home, as opposed to coming into a hospital, which often are overwhelmed when a surge is going on. So the ability to call and get advice, or to learn how to use an oxygen machine at home, it seems so low tech in a sense, but actually it's been a game changer. A lot of lives have been saved by the movement of care out of the hospital into the home, supported by digital devices.
It's amazing. I hadn't thought about, the fact of taking people out of the hospital can be a great life-saving intervention.
Paradoxical.
Paradoxical, but it makes sense with what we've seen with the hospitals being overrun.
Yep.
And also, admittedly, as you're going into that, you're putting yourself into an environment where there is virus, by definition, has been involved and spreading. Wonderful. Well, let me turn to our next question, which comes from Team Albania. They'd like to know, how do you think the global pandemic countermeasures will change after the COVID-19 pandemic? So a little bit back to the lessons we've learned, but asking you to put on your crystal ball, or I guess not put it on, but look at it and tell us what you might see in the future.
We're at a turning point here. One possible future is that we will get serious about global biosecurity, and we will come to grips with our global connectivity and the need to have stockpiles of at least families of vaccines and antivirals that address the known pathogens or the families of known pathogens, so that we'll have more in our freezer. And if a pandemic starts, we aren't starting from the very beginning of vaccine development. We're starting with things that we already have a great deal of knowledge about. And actually that happened in COVID because we had already been doing work on SARS from 2003 and MERS, another coronavirus. So we knew a lot about coronaviruses, and we didn't have to start completely from scratch when SARS-CoV-2 emerged. So that's a future where we have a global mentality. We truly invest collaboratively and in alliance to make sure we have countermeasures and medical equipment necessary to manage a serious outbreak or pandemic. And I think more importantly, we have the systems of being able to deliver that and communicate in a trustworthy manner to get it taken up and used when it's needed. The other possibility is, of course, that once we do bring this under control, people will relax. We'll go back to our old ways. We'll have wishful thinking. There's always the tendency to become complacent and say, well, phew, we survived the pandemic. Now let's turn our attention to other pressing societal problems. That's my biggest fear, that when this is all over, we will have the false sense of security and think, well, in 100 years, maybe it will happen again. In the world we're living in now, it's not going to be 100 years. It's going to be something that we have to be thinking about, even as we're thinking about this outbreak.
And just on this point, are you seeing countries putting in place mechanisms to really plan ahead and be able to deal with this? And given, to your point, we're in an interconnected world, is that also being done at a global level so that there is some way of having that connectivity among national authorities?
I think we're still primarily in response mode. We're trying to get vaccine made and out. We're trying to get antivirals made and distributed. So I think that most of the attention is still on crisis management. But there are efforts to look beyond that. And I think the fact that CEPI, the Coalition for Epidemic Preparedness Innovation, which is a private-public partnership that is designed to try to develop those countermeasures, to have them in the freezer. CEPI is now soliciting a much bigger investment, and CEPI's thought is, well, we have to finish the job with coronavirus SARS-CoV-2, but we better be better prepared for whatever it is that's going to come forward. So let's get started now. So there are some forward-leaning people. I think the Wellcome Trust is in that mindset. There are some parts of the U.S. government that are thinking along those lines, but it's not systemic yet. And there are so many other competing priorities for political leaders' attention, not to mention that when this is over, there are a lot of bills that have to be paid. And the money to invest in the future preparedness is going to be a scarce resource that we'll really have to justify with everything we have from a policy perspective.
One thing I'm hoping that will come out of this as a corollary to having sort of mechanisms in place is that there will be a whole new generation of young minds that will be inspired to go into the science and technology fields to come forward with these kinds of solutions that we're going to need for the onslaught that may come in the future, and that we need to be better prepared for and have at the ready the talent and the capabilities to engage and make a difference.
In every way, STEM is part of this in every direction. It's not just countermeasures, but it's health tech. It's the ability to track and trace. It's new approaches to molecular diagnostics. It's really understanding the ecosystem of the animal-human ecosystem interaction, the climate change surround that's promoting some of this emergence and spillover from animals. This really touches every branch of science. So whatever people are interested in pursuing, there's an opportunity to contribute to this challenge of emerging infectious diseases.
Yeah, that's a great point. And I'm even thinking, as we've heard, of drones being used to deliver vaccines or other health interventions. So you have aeronautics that's come out getting pulled into place. So it is a bit of a it's a great thought that there are so many fields that can be directed at solving what is a global problem. Team Malaysia has asked what I thought was a very insightful question. So mental health has been negatively impacted by the COVID-19 pandemic, especially amongst physicians and healthcare workers who are increasingly experiencing burnouts. What are the key ways or strategies for battling these burnout issues?
It's not easy. And I think I've had this experience when I was directing the CDC, that people are all in the response mode, and they will work 24/7 if it helps solve the problem. But these events are marathons, not sprints. And a manager has to be disciplined about saying, you will sprint for this period of time, and then you will rest. You will sprint for this period of time, then you will rest. And really being forceful about imposing people time off and time away from the grind. Even though you'll feel like you need every single person to be there and be available, that's a short-sighted solution. So part of it is managing people's time. As individuals, I think it's also important to recognize that self-care is important. Sleep is important, and all of the other well-being activities that people need to do. I know I really developed a very severe post-traumatic stress syndrome disorder myself when I was in the middle of some of the most difficult outbreak situations at the CDC. And it wasn't until I would be home and I would realize that I'm not eating, I'm not sleeping, I'm not exercising, I'm not doing what I need to be doing to be an exemplar of good health. For me, it was walking, like just taking a walk, really appreciating my garden, connecting with family and friends, and forcing myself to recognize that I need to step back. But our health workers are really challenged, and part of that psychology is the heroic health worker. And we need to discourage that. People don't need to be heroes or sheroes. They need to do their best, and they'll work harder than normal, but they also have to recognize that they're so precious and so valuable that self-care is part of the response that we need to the pandemic.
I think that's a great point, and I think it can be applied to all of us in this situation where you see the pandemic is really a shadow over so many aspects of life, that we need to be gentle on ourselves, gentle on others, and say, wait a minute, this is not business as usual, and we do need to
eat chocolate
or ice cream, if you're whatever is your preference. So Team Yemen has raised a question. What are your greatest fears as an infectious disease expert?
Well, I can give you a very concrete answer because I lived through SARS in 2003. SARS in 2003 was a virus that was not particularly transmissible unless you were really sick and were able to distribute a lot of virus from your respiratory tract. But it had a 10% mortality rate.
10%?
10%. So there are roughly 8,000 cases and 800 people who died from that particular coronavirus. We could think about MERS, which again is not very transmissible, but in hospital settings and certain conditions can be highly transmissible. MERS has a fatality rate that's something like 50%. So think about a coronavirus that has the characteristic of rapid transmission, like SARS-CoV-2 or the Delta variant, but has the mortality of MERS or even SARS. So while this pandemic feels like the worst thing from an infectious disease perspective that could ever happen, it's not. And that's why this imperative of preparedness and innovation around making sure that we are not caught off guard with another virus, coronavirus or some other family of viruses that's rapidly transmitted and highly fatal. That is a global catastrophe.
And to your point, rapid transmission, we now have certain things we're doing to try and thwart that. Do you think those are going to be with us as strategies and and used, like, and we talk about the flu season, and amazingly there's been less flu because people are taking precautions. Is there a lesson in that to say?
I think there absolutely is a lesson. You know, we've always hypothesized that social distancing and masking would be useful and would be part of our response to a respiratory spread disease pandemic. But we actually didn't have data to demonstrate that that would truly be highly effective at a population level. We had hints from the 1918 pandemic, but it was really cloudy. Now I think we have clear-cut evidence that even without vaccine, if you really impose significant social distancing and masking, you can contain a pandemic. The problem is it's hard to sustain that for a long period of time. But nevertheless, we do have a knowledge about what's important and what isn't important that I think will help us. Very important, especially at the beginning. Because if you think back, if we had been able to implement these measures as soon as we recognized we were dealing with a transmissible respiratory pathogen that was this dangerous, we probably could have gotten off to a much slower start and bought a lot more time and saved a lot more lives before we started having vaccines and antivirals. So it really does matter, and I think that's a really critical lesson learned. But there's also a lot of technology that we can start thinking about as well, because detection really, right now is based on somebody gets sick, you look at their samples, you find the virus, eventually you figure out there's an outbreak, and then you do something about it. But we can detect these things in animals before they spill over. We may be able to detect them in air sampling. We know we can find them in sewage. So why aren't we looking upstream and really, first of all, using our artificial intelligence and our data sciences to predict where are the hot spots where this kind of animal to human transmission is most likely? How can we augment our detection capabilities so they're earlier and well before we have an outbreak propagating in a large city like we did in this case? So lots of opportunities for innovation and technology here to really move the whole process upstream and buy time before we have countermeasures that are effective.
Amazing. Let me go to the next question. It's from our team in Ethiopia. How can STEM or digital health technologies be implemented globally to enable health systems to enhance universal access to resources?
Oh, that is a
simple question.
Tough question. Having spent a lot of time in Ethiopia with the health ministry there, I think Ethiopia is an exemplar of a country that has already taken a number of steps to try to make their health resources reach the rural villages through, the outreach programs and so forth. But we are a long way from having that network effective, even all the way through Ethiopia, let alone, the entirety of the countries that really need to build frontline health services. But I think technology is part of the solution. Smart devices are now ubiquitous in most societies, even in very rural areas. We need the bandwidth, satellite connectivity and the support so that we can have the information flow be seamless and consistently reliable. But the technology exists. Now we just have to populate it with the right information and the right reliability standards so that it can reach all of the places that we need it. As we've learned in this pandemic, we can provide a lot of care without a hospital, and we can provide a lot of care without a doctor, but we have to have a mechanism to get information to people, but also in technology terms, the digital devices to monitor and bring the circle all the way back to be able to inform the knowledgeable people at the center of the hub so that they can give the best possible advice. But that's all technologically possible. It's just how do we implement it, how do we fund it, how do we find the resources to accelerate its implementation.
That's an exciting vision, and we see over time it's hard for us to predict all the new things that will be invented and will come about and can have an impact, but you need to have a target and say this is what we're trying to achieve and put our mind power behind the solutions that would go to it. And I think you're right. I think the lesson of being able to be connected with tools that empower ourselves to be able to do things is I think a very exciting area.
It is exciting, and I think the other part of that is that we can use the same tools to help us investigate and detect new cases during an infectious disease outbreak. My cell phone tells me everywhere I've been in the last few weeks. Your cell phone tells you the same thing. It doesn't take a lot of imagination to put that information together and say, oh, you and I were both in the same bus at the same time on the same day. And then to recognize that if one of us is infected and the other isn't, that's a reason to check and make sure that we're both okay. So these tools are being used in limited ways in some societies, but that kind of opportunity exists everywhere.
Well, our last question comes from our team in the Philippines. What advice can you give to young people like us who are interested in helping our community in finding solutions to health problems?
It's a broad question, but I think one of the important things that I learned along the way was to not assume that I know what problems need to be solved. So, as a scientist and as a physician, I think that I might have had the false impression that I could say, oh, this community needs that or this community needs that. So probably the starting point of all this is listening, to really get out on the front line, interact at the community level, really understand what are the true priorities. And let me give you an example of this. You mentioned earlier the Ebola outbreak in the DRC. And while Merck had an Ebola vaccine that was important in helping to contain that outbreak, when we were trying to deploy the vaccine, we learned that for a lot of the people in the village level, their biggest fear wasn't Ebola. Their biggest concern was measles, malaria, and then the civil unrest that they were dealing with. So Ebola was something that was an annoying situation, but not what they were most worried about or most concerned about. So that reality check is the starting point, because once you agree on the problems that need to be solved, then you can focus your efforts and you're much more likely to make a difference.
So one other thing I'll pick up on your opening comment about how you entered into this field. Is for each of us to feel that we have something to offer as providing solutions, I think, is a big step, because so often we think, okay, someone else will do it, or someone else is better situated to do it. But just as you learn by the bunnies and the birds, you can do it yourself, and you can have an impact and make a difference. And that's certainly one thing I'll be taking away from this conversation, and I hope our students feel empowered to step up and go make a difference themselves. So it's been wonderful to have you here today. And really appreciate the great answers you've given to what I felt were great questions that were submitted. And with that, we'll draw to a close.
Thanks, Jeff, and I'm inspired. These questions have got me thinking again, too. So thank you so much. Great to talk.
Thank you.